I gave an interview to The Guardian yesterday, and the reporter asked me, how in the world did nurses end up going from healthcare heroes to public enemy number one? And I said, oh, you don't know? Let me fill in the blanks for you. Let me tell you. So in the beginning of COVID, there was no way we were going to not be healthcare heroes, right? And rightly so. But healthcare organizations didn't like that, but they couldn't do anything about it just yet, but it's okay. They played the long game. But we very quickly started seeing things like not being given the bare necessities to do our job, being told to get rid of every single thing we were taught in nursing school and not be given a freaking mask, and put our lives at risk, put our families' lives at risk, come to work when we're sick, exposing patients and coworkers, be too sick to come to work because we caught COVID as a direct result of them not providing the bare necessities and being told we're not going to get paid, and a million other atrocities, right? And so it lifted the veil that remained for a lot of nurses who wanted to believe that hospitals and nursing homes and their bosses were ultimately good people and that they ultimately were doing the right thing and cared about patients and patient outcomes and their employees. There were some of us that knew that wasn't the case, but there were still a lot of nurses that kind of suffered under that delusion and buried their head in the sand. COVID lifted that veil completely. There's no nurses left at this point, I think, that believe any of that anymore. It made it undeniable that they only care about making money at the expense of patient lives, patient outcomes, nurses' lives, nurses' licenses. If they can make one more dollar at the expense of any of those, they will absolutely do it every single time. And we couldn't deny that anymore. And so a lot of us left and we started traveling and making more money than we have ever made. And they hated that. And we became empowered and we started calling them out for these things, which nursing really has not ever done before. A rogue one or two nurses here and there, hello me, would do it, and then they would retaliate against them to make an example of them. But as a whole, nursing didn't do that. And we started doing that and they hated that. But they couldn't do anything about it right away because we were healthcare heroes. But they played the long game. They waited for the opportune time when tides were, changing and shifting and COVID deniers needed someone to blame. And they started planting really negative stories about us in the media. Yeah. So it used to be, once in a rare while, you'd hear about some crazy rogue nurse doing something. It was rare. Now it's an everyday occurrence, right? And suddenly travel nurses with their exorbitant, wages were being blamed for shutting hospitals down and crippling them financially, which never happened, by the way, because meanwhile, they were pocketing the billions of dollars in COVID relief funds, but no one wants to talk about that, right? But they vilified all travel nurses everywhere. And they started just reporting like every little thing that a nurse ever did wrong, which you used to not hear about, was suddenly being reported in the press, right? And blown up into something that it wasn't. And layman's didn't really, have the background to understand it, right? So it's constant. The constant bad publicity is everywhere. Now we have attorneys that are actually advertising things like, if you or a loved one was harmed by a nurse, please contact. You can't turn on the TV without hearing something that a nurse did wrong these days, right? But that wasn't enough, the negative press. So what did they do? They started criminally prosecuting nurses. So you get the first big case, the poster child for criminal prosecution of nurses, Redon DeVos. And what they didn't expect was that nurses around the entire world were going to clap back and go, absolutely not. You are not going to put us in impossible conditions where we are almost insured to make a mistake and fail, and then throw us in prison. Are you kidding me? They didn't like that. They didn't like that only empowered us more, right? That it only took more nurses away, and they didn't like that. So what did they do? They doubled down yet again. And we went from one rogue DA in Nashville who was running for re-election, wanting to make a name for himself, to now we have jumped that bridge and we have healthcare organizations, nursing homes, hospitals, directly reporting nurses to their local law enforcement when there's a mistake. Yeah, you heard me right. So it used to be that if a nurse made an error, they would get reported to the Board of Nursing, right? Maybe the state in some cases. Now, every single time there's an error, they are reporting nurses to literally every single agency, like ones that don't even cover nursing, like Department of Health, like all of them. And they are going directly to their local law enforcement. So if you are, public and you don't know anything about nursing and you're just watching the news, you're going to think that, oh my God, nurses are sadistic psychopaths. They are harming patients every single day. They're costing them billions of dollars. Nurses are awful. And they've been successful in this, unfortunately. Yeah. That is how we got from healthcare heroes to public enemy number one. It is all because of the greed of healthcare organizations.